I'm Audrey Brown. I'm a speech-language pathologist here at St. Mary's, and I have been here for a little over 13 years. Right here in this room, I was with a patient. She had had a spinal surgery done, and she was in a halo. I don't know if you've ever seen them, but it's a cage and screwed into the skull. And she had also had a stroke. So she had been on a feeding tube. She really wanted to eat again, and that's another part of my job is I assess swallowing and safety. And I had a pudding ready, and she came in my office. She was sitting there, and we were getting ready to do the assessment. I was going to see how she could swallow pudding. And all of a sudden I felt this kind of like two fingers were being pushed into my eyeballs. It was a very unusual feeling. It wasn't a headache, it was just really intense pressure. And then it went away, and then it came back, and it went away. And my patient was very concerned. I said, "Oh, I'm okay, I'm okay." And then she said, "Well, I haven't told the nurses upstairs about where I am." And we had kind of set this up on the fly. So I really didn't, it wasn't up on her board. So she said, "Oh, can you call the nurse's office?" But I think she really figured out that something was wrong. So she wanted me to call somebody, and maybe somebody else would understand what was going on. So I stumbled to my desk and went to the phone, and I called the nurse's station and told them that the patient was with me and that I was doing a swallowing assessment, and she'd be back in about a half an hour. And then as I put the phone down and I picked it up again, I don't know why, and a colleague of mine, Monica, she called me. She was calling me, so she was there, and yeah. And she's a speech pathologist, not currently with us here, but in another capacity. And I was talking, and she said, "Audrey, you don't sound right." And I said, "Really?" And yeah, you should get some help. And I said, I'm okay. And I hung up the phone, and then all of a sudden I hear code 99, speech therapy, hallway, room 4. And I'm yelling at the ceiling going, no, why are you doing this? I stumbled back to the chair, and I had the pudding in my hand, and then I dropped it. And my face felt funny, and I deal with stroke every day. I educate people on stroke. I give a little talk every so often to people who are working in long-term care in the community, and talk about stroke and what to look for. And it's going through me right at that moment, and I had no idea. So I call it my period of stupid. I just had no clue what was going on. All I could think of was, okay, this is weird, and it's getting in the way. So when a code 99 is called, everybody comes running. Doctors, nurses, lab technicians, managers, everybody was at my door. And of course, they went right to my patient, because she's in a wheelchair, and she's in a halo, and she is obviously the one in trouble. And then luckily she could talk, and she said, "No, it's not me, it's actually her." I don't know if it was denial or just lack of awareness, and I think that is what happens with a stroke, is because it's such an insult to the brain. And I've met patients who tell me, "I had no idea what was going on, and I just let it go for 4 or 5 hours. You know, I didn't tell anybody." And I'm just saying, how could you do that? But now I realize you are in shock. You don't process information the same way. I wasn't putting the pieces together, and when the physiatrist, one of our attending physicians, came in, and he goes, "Audrey, I think you have to go to the hospital. I think you're having a stroke." And I just looked at him, "What?" And I was actually belligerent. I was refusing. I said, "I'm not going anywhere. I'm fine. My car's in the parking lot. I have to get it home." I was just not making any sense to anybody. And his secretary had had a stroke several years ago, and I know her well. And she had a right CVA like I had. And Dr. Ferris kept saying to me, Audrey, remember her. And I said, oh yeah, right. And so I went along. I was still saying, okay, no IV, no nothing. And we went in the ambulance and lights and sirens and got to KGH. In my mind, when I was talking to the EMS guy, he was wonderful. I was still refusing because I said, don't you dare put an IV in my arm on our Kingston streets. I mean, I'm sure you're really good, but no. But I had the oxygen going, I was feeling good. And I said, this is going to be a code stroke, right? He said, yeah. So I knew that as soon as we got to emerge that all the neurology, the team would be there. And I'd be put into the CT scanner and I'd be asked lots of questions. I knew the drill. I knew what was going to go on. And while it was happening, it was really surreal. It was kind of like an out-of-body experience almost. And I was laughing, and they showed me a picture. I don't have it here right now, but it's a picture that I use in my assessments. It's a very standard picture, and I get people to describe it, to look at their communication impairment. And they flashed the picture up and I laughed, and they probably thought I was losing my mind. I said, I know this picture. I said, actually put it away and I will describe it for you. And I did. And they kind of said, oh, okay. And then I can't remember going into the CT scanner, but I did. And afterwards, Dr. Brunet, the neurologist, saw me and he goes, well, there's nothing showing up on the CT scan, so we can't give you TPA yet. And often a stroke will evolve. So what I had was a TIA. They were waiting for the MRI machine to be freed up. So we waited and waited. And at one point, I felt my dog on my chest. I felt like my dog, I have a little Bichon Frise, and I was petting it with my affected arm. But I wasn't. But that was my image. And then I saw Dobermans next to the bed with party hats on. They looked very friendly. They were on my right side. And then I was asked to do the finger-nose thing. And when I couldn't do it, somebody took my hand and said, is this your hand? And at that moment, I knew right away, I know that question, because they wanted to see if I have left neglect. And left neglect to me would be horrible. And that's just not recognizing that the left side of you exists. And so I knew this. So I said, oh yeah, that's my hand. And inside I'm going, that's not my hand. You know, it was really, really bizarre. And I knew and afterwards I admitted, I said, actually, I did have left neglect. I didn't know what that was. I was there for 7 days. They wanted to watch me. They wanted to do lots of tests. They took an enormous amount of blood. The only real deficit I had was I was extremely tired. For about 7-8 weeks, I was very, very tired. And it's not the kind of tired like a physical tired. It's a overwhelming mental fatigue, such that, you know, I would be at home, and if I hadn't gotten dressed by noon, it wasn't happening. It would just be a lot of, if I'd be thinking or reading or doing something, it was a lot of work. It was a lot of work to stay alert and to stay focused. And I mean, I couldn't go back to work in that state. The neurologist said to stay off a month. I ended up staying off about 7 weeks. And I mean, I had no real other deficits. And people, you know, to see me, and a lot of patients that do come here have fatigue. And I'll often see a patient at the end of the day or towards the end of the day, and they'll be tired, and sometimes they fall asleep right here. And now I know why. It's incredibly fatiguing. And to think that you would have to do 3 therapies and do everything in a hospital that you're expected to do when you're in rehab, I look at them and say, wow, I have a whole new perspective on the people I see. I mean, I knew that they had fatigue. I know from a book perspective that what they're going through, but now I actually know it. And actually thinking back, about a week before this happened, I was with another patient who was on our complex care unit, and she had a really bad stroke. And I was saying to her one day, I said, I wish I knew what you went through. You know, I want to know what you went through. And I guess you have to watch what you ask for, because it might happen. And it did. But in a way, I'm thankful that it happened. I have a very different view of my patients, and I have a very different view of what it's like to go through on the acute stroke unit at KGH, what it's like to be in Emerge, what it's like to be in an ambulance. It is it's traumatic, and it's a feeling of safe as well. You know, I felt safe the whole way through. I felt, okay, I'm in a good place. I'm not out in the boonies. I'm so close to a great stroke center.